My name is Sofia Noori, and I am one of the black hairs that Mark Neve was talking about, and also the last opening act between you and Beth Wilson, so I'll try to keep it brief. I'm also the OSR rep from UCSF, and along with Coffee Hemphill, the junior representative, we organized the nominations for Beth Wilson. So Beth has many titles at UCSF. She's an outstanding family medicine doctor. She's the vice chair of education in the Department of Family and Community Medicine. She was, for several years, the director of the PRIME program, the program in medical education for the urban underserved that trains physician leaders to care for underserved populations. She's now the director of mentorship for PRIME. And, but outside of all of these very official titles, Beth is so much more to the UCSF community. During the nomination process, this became very clear to me. And every time we've nominated an Arnold Gold nominee from UCSF, Beth has always won the popular vote with the medical students. She's nominated twice by us. And the dozens of stories that we received from the hundreds of students that voted for her really illustrate how much people love her. One of my favorite stories that really illustrates this happened when I was writing the nomination, or helping to write the nomination packet during my trauma surgery rotation. And I was in the call room with my resident. This was in Fresno, by the way, which is 200 miles away from San Francisco. And my resident asked me what I was doing that weekend, and I told them, oh, I'm editing a nomination packet for a Humanism award. He asked me who it was, and I said it was for the former PRIME director. And he turns to me, and he says, Beth Wilson? And I'm like, yeah, do you know her? And then he sits down next to me, pulls out a chair, puts his notebook down, and for the next hour, he tells me about the first time he met Beth Wilson. It was several years before, during his medical school years, and he had just exited a meeting with some administrators about his academic performance. And as a first-generation college student for Latino immigrants, he was having a hard time in medical school. So he was exiting the UCSF campus and was on the sidewalk, just standing there, dazed and pretty down and out. And then a little petite woman came up to him and asked, "Are you okay?" And then Andreas, the resident, just poured out what had happened to him and how he felt about his place in medical school and whether or not he belonged there. And Beth, the petite woman, listened to him and brainstormed with him ways for him to get through this process and help him believe in himself again. And that moment was so powerful to him that several years later, he spent a full hour telling me about it and what that meant to him. These stories, like almost every student at UCSF and several hundreds of members of the UCSF community have stories similar to that regarding Beth Wilson. She helps people believe in themselves, and she empowers students and patients and colleagues to feel like they can do better and to believe in what their capabilities are for the future. And I think that's the most valuable thing anybody can do for you, to help you believe in yourself. Beth has, with her wisdom, inspired so many people in the UCSF community. And today, I hope with her speech that she will inspire you as well. It gives me great pleasure to introduce to you Dr. Elizabeth Wilson.
Wow. I'm already teary, so this is gonna be a rough ride through my talk. I want to start by thanking all of you. It's a real honor to be up here, nominated and supported by the people who inspire me the most, the students in the room. So thank you. Of course, thank you to the Arnold P. Gold Foundation and to the Doctors Gold in the room. This is, I guess I would like to say it would be wonderful to see you put yourselves out of business, because we don't have to talk about whether or not doctors are humanistic. But the fact that you were here means so much. Thank you. And thank you to the AAMC for partnering on this award and to recognize that humanism is indeed integral to what we do. As physicians, as healers, as researchers, as policymakers, we were all going to do wonderful things, and humanism should be part of that. So I know how the Arnold P. Gold Foundation thinks about humanism, but when I heard about the award, I thought, oh, of course, I know what humanism is, but then I thought, oh, actually, I'm not exactly sure what the definition is. So beyond looking at the foundation's website, I looked it up in Google. So I'm going to read you two definitions. So the first is from the Oxford Dictionary, and it says, humanist beliefs stress the potential value and goodness of human beings. And the American Humanist Association says, humanism affirms our ability and responsibility to lead meaningful and ethical lives capable of adding to the greater good of humanity. So with that in mind, I think Sofia just started this with a story, and thank you for that story, and that was incredibly powerful for me to hear. And also I sort of feel like I want to share more stories because that's what it's all about. And I want to share stories about the people who have made me be a better human, and then I'm going to share stories about you. So as a kid growing up, I pretty much believe I could do anything if I really tried hard enough. And not in a completely unrealistic way. I didn't think I could fly. I didn't think I would be like a millionaire. Although I guess in these days it would be a billionaire. But I really did think that if I put my mind to it, I could do it. And the reason I believe that is because my parents believed in me. And my parents are here, so I'm going to embarrass them for just a few minutes, and then I'll start embarrassing other people. So one of the things they did was just to support me in my endeavors. I used to run cross country, and I'd be at some cross country meet, an hour away from our town, which in Massachusetts is like, you might as well be in another state. So it was weird to move to California, where people are like, oh, let's drive, 3 hours to ski and then come back. But in Massachusetts, everything's very close. And so I would, basically be like running in my race, and I would hear, go Beth! And I would look over, and there's my dad. He just showed up just to say, go Beth, as I ran by. I know that some of my decisions and declarations in life were probably not what they had in mind. I transferred out of college after my first year. I came out of the closet a couple years later, and those are hard decisions to watch your children make. But once they got their heads around what I wanted and what I believed in, they were all in. And we all know how that feels to have people who were all in, and I feel very lucky to have parents that were all in. They're also my first role models. So my mother, who I think many would call a workaholic, in a nice way, in a gentle way. But the reason she was a workaholic, and still is that she believed in doing the job, and the job that she felt passionate about, and she believed in doing it well. And there's really not a person or an organization that she touched who didn't end up being better and stronger and definitely more organized than before they encountered my mother. My father, not to be outdone by the stubborn streak in our family, or determined, to say determined, not stubborn, it's the flip side of the coin. He, and people who know me know this story, my father bikes his age on his birthday every year. And when I've tried to say, gee, maybe we could switch to kilometers, I'm his biking companion, so I have a lot of reason to think about how to change this around. So, gee, we could do kilometers, we could do it maybe over a couple days, and his simple response is, no way. And this year, his tire went flat about a mile before the end. So you can imagine we did not just simply call it a day. I pumped the tire up, and I think we would have just ridden on steel wheels to get to the end, and we did indeed make it past the desired mileage. So that really, growing up in that atmosphere with that kind of support sort of led me into life with a really a great start, a great foundation. So in college, which I did finish, by the way, it's hard to get to medical school without finishing college, but I did finish it. I studied art history. So many of you did not study the sciences, you studied humanities, and I loved art history. I was not an artist, I was not a good artist, didn't even try actually. But I loved seeing art and I loved supporting artists. I started a business right after college, an artist representative service called Art Reps, very clever. And our whole job was to advocate for artists, and I would get so excited when we got an artist to show or sold a painting for them. And of course, we didn't understand the concept that you're supposed to take like a cut of that, so the business totally failed. But I got it, I got the sort of the bug for being an advocate. And I ended up moving out to the West Coast, to San Francisco, and working in art galleries. And they were nonprofit art galleries that supported artists who were committed to social and political change through art. And my boss, Rennie Pritikin, was one of those visionaries who could just pluck artists from really obscurity, from the shops behind their houses or the basements they were working in, and put them on the map and give them the chance to show their work and have their message heard by the public. And there's not, to this day, when I go to like the Whitney Biennial or some other contemporary art museum, every single time I see an artist that started at New Lincoln Arts. And that just amazes me, and that sort of, that quality in someone was very inspiring. I also fell in love when I was in San Francisco. And sort of ironically, from someone who lived like the next town over from me and went to junior high with me. Her name was Brett, and she was beautiful and smart and funny. She had just finished treatment for Hodgkin's disease, and so she had this sort of love of life. Unfortunately, as we all know, you read about really high cure rates, but there's the people on the other side, the smaller percentage. So her cancer kept coming back, and she did not ever really cross over to that other side beyond cancer. And she was treated at UCSF, and so this was my first encounter with UCSF. And there we met oncologist who was a fellow at the time, Andrew Levitt, who is actually now a treasured colleague. And he was the first doctor I knew, really, but also he was the role model. He became the role model for me, what it means to be a humanistic doctor and what it means to be compassionate. He tried his hardest, obviously, to beat back this cancer, but even when the therapy was failing, he stuck with us, and he celebrated the small wins. He mourned our losses. And I ended up going back and going to sort of the prerequisite classes for, I didn't know what, maybe physical therapy, nurse practitioner school, medical school. I wasn't sure. I ended up choosing medical school, and I thought it was just 4 years. So, right? 4 years, you're a doctor, right? And it seemed to be the same, physical therapy, 4 years, you're a physical therapist, so I thought, well, why not be a doctor? So if there's anyone in this room that is unaware of residency, I'm going to tell you right now that it isn't just 4 years. It goes on for a little bit further. It changes because you get that MD thing and you get to actually be a doctor. But certainly the training continues, which is a darn good thing, because I needed a lot more training after medical school. So I ended up at Tufts in Boston. And on maybe the third day of medical school, I went to this activities fair. Y'all know the activities fair. It looks like this, with people sort of standing around with little flags. And I went to the LGBT table, and there was one person there, but I think we were the only two LGBT people at the entire school. And her name was Lisa, and Lisa actually later became my partner. But she kind of, tried to encourage me about being an LGBT person at Tufts, and she also mentioned this MD-MPH program they had. And she invited me to go and listen to their presentations of what they did over the summer, because she was a second-year student. And so I went, and they were amazing. She talked about women with HIV who are incarcerated. Someone else talked about domestic violence in the Vietnamese community. It just went on, and I thought, oh, this is great, but I thought this was like medical school. And people were like, oh, no, this is a medical school. This is the MPH part of it. And times have changed. Medical schools have embraced some of these concepts, but at that time, that was sort of it. Like, if I wanted that perspective, I needed to get in that program. So I did. I basically begged my way into the program. It turned out that there was a student who hadn't shown up. So I went home that night, applied to the program, and got accepted the next day and started. And that turned out to be the saving grace for me. As you know, I was not a pre-med major. I definitely suffered those first 2 years, and I'm sure some of you were like, oh yeah, the first 2 years. Like biochemistry, I was like, whoa! And other people were like, 10th time I've read about the Krebs cycle, and I was just like, Krebs what? It's a circle? Like, wait a second. So I was really, I failed my first test, and that's a moment where you go, wow, they made a mistake. I am not supposed to be here. The MD-MPH program and my peers sort of kept me honest about why I was there. I was there to be an advocate. I wasn't there to sort of, Brett inspired me not to go to med school to cure cancer, but to be a patient advocate and to be like Dr. Levitt at UCSF. And so I kept going because, as you know, we have that persistence in my family. And I made it to third year when I actually got to work with patients, and that was a game changer because I loved it. It was a moment where the humanism comes out, because you get to interact directly with the patients that you're caring for and see teams interact with patients. And I also got to work in a community health center, which was incredible to see what they did. I didn't really understand what that concept was, and I went with the medical director of the clinic down the road. We just walked carrying a little bag, and we went in to a senior center and clipped toenails. But the whole point of that was because people would come to get their toenails clipped, and then we could kind of talk to them and get them engaged in their own health, and maybe bring them into clinic, or maybe just continue to go to them. I want to actually pause here because I mentioned Lisa, and I wanted to talk about the fact that our partners and our families, whether they're friends, partners, parents, they put up with a lot. Medical school is hard, residency is hard, being a doctor is hard, and it takes up a lot of time. And Lisa supported and encouraged me to spend the time I needed to do the work I wanted to do. And I'm forever thankful for that. So I chose family medicine. I chose it for lots of reasons. Mostly I chose it because it felt like if I wanted to work on population health issues, if I wanted to work with underserved communities and be that first point of access, that was the obvious choice for me. And when I was looking at residency programs, lo and behold, it turned out that UCSF had a residency program based at the San Francisco General Hospital, which is our county hospital. And so I went back to California after being gone for 7 years. And it was a really key decision. So many of you, when you're choosing residencies, you're gonna have like a big Excel sheet. It's gonna be like, didactics, morning rounds, call schedule. It's going to have all these things, and you're going to have check marks, and you're going to have lists of programs, you're going to figure it all out. And that's good. You should do that. You need to do that. And then at some point, you take that list and you just throw it out. Because what you realize is, you have the sense of the programs, and now you have to choose with your heart. And you have to choose a program where you feel like they share your mission, where you feel like they're your people, and where you feel like you can thrive. And that's when you have to ditch all of the shoulds that people are going to say. And they say it because they want to support you. Oh, you should do, right? Whether it's a career choice, like what field you go into, or a residency choice, people are going to have ideas about what that should be. And when it comes right down to it, you need to listen to what's inside. And I did that, and it was the best decision I ever made, and obviously I'm still there. So I had a wonderful experience. I had incredible role models, teachers, mentors, and it confirmed that this was the kind of work I wanted to do. After residency, I couldn't really shake the notion that I wanted to do kind of population-based health, or something that was kind of beyond just that individual interaction with the patient. I loved that, and that fuels the fire for me, but I also wanted to do something on a kind of a larger stage, something to impact communities. And so I talked with Kevin Grumbach, who became my mentor, boss, and friend. And he kind of suggested, why don't you try this research fellowship that we have and see if you can build on your MPH skills and see if that sort of fits. And we did some really terrific studies together. And 3 things happened during fellowship in addition to the great work that we did. The first thing I realized, and this is important stuff, to realize what maybe you don't love. So I realized I'm not really a researcher, not in that way. And I would be in a room with people who had like the stacks of data, like, oh my God, look at this, they're so excited. And I would be like, oh, okay, that's interesting. Like, it just couldn't generate that level of passion that they seem to have. And I kind of recognized, like, this is important work, but I'm probably not the one who should be doing it as like a full-time researcher. I also, the second thing was I knew Kevin Grumbach because he was one of my attendings, who used to always run off to do other things after rounds, and I never really knew what he did, but then I learned what he did, and he was running off to do research and to really be a leader, not only in our department, but at our school, at our campus, and on the national stage. And his role modeling was so important for me. Because a couple things, and I'm just going to look right at you so everyone knows that you're here. Because I've embarrassed my parents, it's only fair, and Sofia is coming up. Kevin, so he speaks the truth, and sometimes is a little bit of a thorn in people's sides, but not afraid to do that, because that's sometimes what you have to do to get stuff done. Now, if you like jam the thorn in and cause like a pneumothorax, that's probably not going to help your cause, right? You just kind of got to go a little bit, and then let it go for a bit, and then because a lot of the stuff we care about, and I'm just going to say we, because I'm going to just say we all care about this. So first of all, we know we care about humanism. I like to think we all care about reducing health disparities. We all care about increasing workforce diversity. And we care about our patients, and that our patients receive the best care possible. And so we've got to keep pushing that thorn, twisting it around a little bit. And he is, I just follow him around, being sort of a mini-me, and trying to, come into my own over time. But it's been an incredible, again, like sort of adding to that foundation that my parents started. And then a third thing happened during my fellowship. I met these 2 students, Mika Godzik and Yoshi Lang, who, I was a fellow. I was doing my own thing over here, and they said, oh, we'd like you to come to a conference in Kansas City. I didn't even know which state that was in. I still don't know. And it's an AAMC conference on health disparities and medical education. And I had done a study with Kevin on medical student and physician perceptions of unfair treatment in the healthcare system. And that's how they got my name. And so I'd never been invited to a conference before by students. So I was like, oh my gosh, yes, yes, yes. And so I went with them. And I knew it would be great, but I had no idea it would totally change my career path once again. I loved it. I loved being in a room like this with students who were so passionate and so dedicated to the work that they were committed to doing. By the time we got back, we had already started the Health Disparities Working Group, which was going to be and became a big group of a collaborative of students, residents, and faculty who wanted to change the curriculum. And we made changes. And that was just to be with them was so inspiring. And that sort of led to learning about the program in medical education for the urban underserved, which was a program that UCSF was about to launch. And there were a whole bunch of folks on this committee, including Maxine Papadakis, Kevin Grumbach, David Irby, Helen Loser, all these leaders in the school, and to plan this program. And this program that was designed to say, let's bring more students into our school. We need to increase the class size. And this was a statewide initiative. But let's do it in a thoughtful manner. All of these students are going to be students that we train and support to work with underserved populations. And we are also going to make a point of having an incredibly diverse student group. And I started going to these meetings and I was like, oh my God, this is what I want to do. This is everything that I care about right there combined. And so, and this is a lesson learned that I will share with you. I just kept showing up. I just kept going, kept going, kept going. I would volunteer to do things, you know, oh yes, I'll do that, oh yes, I'll write those notes, anything to kind of keep me engaged. And by the time that the program needed to be rolled out, guess who was still there? Me. And so I just, you know, like, oh, me, choose me. And eventually they chose me and led me and had faith in me to be the first director of this program. And that was 10 years ago. And I've never really looked back because that really, going into medical education turned out to be exactly where I needed to be. And I can honestly say that there's nothing more incredible and rewarding than being surrounded by people like you. It gets me out of bed every morning, it keeps me inspired, it's incredibly powerful to have you all say, this is what needs to be done. We believe in this. We want this to happen. Help us do that, but like don't smother us. Don't tell us what to do. Just help us do what we need to do. And that's what we do. Catherine Lucy recently said that part of our goal is to help you find your voice and when conference. And so she shows up and she gives talks at these places. Like she talked to the medical staff recently at the UCSF Medical Center. And she went to Dreamforce and talked to them about healthcare disparities and about why we should care. Not just doctors, not just medical students, but everyone. And of course she then designed an app and started a company for the app and just, you know, had to give up after that. So what I get to do is not only cheer her on and amplify her voice, I get to talk her down when she feels anxious. I get to remind her how amazing she is. And I get to share some knowledge and some skills about how do you frame messages. And that is the joy in my work. And that's why even though I'm up here talking at you and being honored, it's really about you. And that's what makes this award so special. So I'm going to end with a story about a patient, because no matter what field we go into, no matter how we spend our time during the day, and sometimes late into the night, it's about our patients, it's about their families, and it's about their communities, and that's why we do the work we do. So this is about a patient named Tammy, and it's her real name, and she gave me permission to tell her story. She was referred to my clinic about 8 years ago, and she was part of a study on hepatitis in a methadone clinic. And they were trying to see if assigning a primary care physician would help in terms of treating their hepatitis. And so she came to every appointment. She would show up, she would look at the floor with her hair sort of hanging down. And she was pretty clear that she wasn't interested in finding out more about her hepatitis. She had other things going on. And she said, just basically back it off. I will come to the appointments, but I'm not going to do the lab work. I'm not going to do all that stuff. And so I kept making appointments because she kept showing up. And over time, her story came out. And what I learned was that her mother was stabbed in front of her, creating huge trauma that she never really recovered from. And she started using drugs. Things started spiraling out of control. She lost her job. She had her kids taken away. She lost her house. And when I met her, she was living under a bridge and recycling to make a little bit of money to get food. And that's an incredibly powerful story. And she showed me her hands, which she had always tucked away, and they were covered with cuts, just covered. And a couple times I had to treat her for infections. And then one day I sort of remembered that I had a box of gloves in my garage from a student project. We actually went and cleaned up trash. I'm from California. If I dive under the table, we will know why. So I had these gloves, and so I realized, what am I doing with these gloves? And so I figured out where she lived. I asked her where she stayed. I drove to where she stays, and which is, she has a little lean-to shopping cart, lived with her boyfriend, and I brought the box of gloves, and she was like, Dr. Wilson, where am I gonna put that box of gloves? And I was like, right. Okay, yet another lesson learned. And I said, how about if you take a few and then I'll bring some back, we'll keep them in my car. And she said, yeah, that would work. So every month or so I would drive by, give her another couple pairs of gloves. And I never had to treat her for infections anymore. So that wasn't a brilliant solution, but it was thinking upstream a little bit, right? Don't wait for the infection to happen. Try to prevent it in the first place by thinking about her life. So probably a couple years later, she got beaten up by a stranger. People who go around and beat up people who live outside. And she realized at that time, even though she had a boyfriend who, can't be with her all the time and with some protection, she realized she needed to be housed. And so, thanks to a pretty progressive policy in San Francisco that puts housing above sort of all, including kind of drug treatment and everything else. If you can get housing and get on your feet, you can take care of the other issues. So we got her housing with the help of amazing social workers. And she started coming to appointments. Her hair was clean and pulled back. She was looking me in the eye. And eventually, over time, she reunited with her kids, met her first grandchild. She had to keep saying no to drugs that were offered to her in this SRO, and wasn't always successful, but always bounced back. And I was clear with her, I know that sometimes it's going to be hard, but I'm going to be here when you need to bounce back. And so, I would keep making, even if she missed an appointment, I would keep making them, and she would come back. And now she's interested in learning about hepatitis. She's taking care of a bad knee. And she's doing wonderfully. And no, not as well as anyone would hope, but certainly because of her resilience and persistence, her health has improved and her circumstances have improved. And I recently asked her to talk to some brand new first-year medical students who came down to meet her. down to, I say down because the medical school is sort of on a hill, and the general is down in the Mission. I always thought a zip line would be a good idea, but so they came down and they met with her, and she told the story. And at the end, one of the students, as you all know to do, said, "Can you give me some advice? How can I be a better doctor?" And she said, "Just listen. It doesn't matter how we look or how we smell," and she said that. "We all have something to say, but you can't hear us if you don't listen." And as the session wrapped up, she started to cry, and the students panicked. That first time that a patient cries, you think, "Oh my God, I've destroyed them. I made them feel terrible," and so they were all apologizing. And she said, "No, you're not upsetting me. It's an upsetting story." And then as she was leaving, she turned and she said, "Thank you for listening." At which point I burst into tears, and it was, So I learned so much from Tammy, and we all learn from our patients. And it's not just about resilience, it's not just about preventing infections, but it's really about listening. And so I've told you stories about people who modeled humanism for me, from my parents to my teachers and mentors and my students, my patients. And without their modeling and without people's belief in me, I wouldn't be able to do what I do. I wouldn't have the strength to believe in all of you. And I think that's really, if there's only one thing you remember from today, it's that I believe in you. We believe in you. Your faculty, your families believe in you. And what we really want is for you to believe in yourselves and each other. Thank you. I'm here to answer questions.
We have a few minutes, so if anybody has any questions.
Hi, Quentin from Vanderbilt University. Given the fact that the statistics in the United States are still at about 80% of our medical students come from the upper quartile of society, what is a group like yours doing to address that admissions policy and make it more critical?
Yeah, that's a great, so when you look at the AAMC data on lots of issues, from income of our students and our students' families to race and ethnicity, to their attitudes towards underserved care, actually. We're in a little bit of a crisis. In fact, we're in a big crisis. And I think that the program that Sofia is in is one small piece of the puzzle. I think we need to be thinking about big pieces of the puzzle. So obviously people are working at school levels, at regional levels, and at national levels on a variety of initiatives, but I think part of it is that we have to start connecting those initiatives and start talking to each other about what works best. And part of this conference, I think, is that. But at the end of the conference like this, if we all just say, "Well, I got to talk about my really cool program, now I'm going home," it doesn't really make sense. We have to think about, now I'm going to connect to you and talk to you about how you do your program and how to grow my program or how to share what I do and vice versa. I also think that thinking about income and thinking about underrepresented minorities and other students who represent diversity in lots of different ways, and how we're having such a hard time. I think we have to think about, and you're all going to agree with me on this, we have to think about debt. And we have to think about what do we do about the tuition that keep going up. And I understand why they keep going up. But how do we make sure that people can either pay off their debt or get scholarship funding or something? There are countries where you can go to med school for free. This is not one of those countries, but we should be seriously thinking about why are we continuing continuing to go up. The only way to get people into school is to bring that down and to say to people, we want to support you no matter how much money you have coming in. Because if I didn't have much money and I was going to med school at this point, I would just look at the concept of the kind of debt that I would walk out with if I couldn't get some sort of full scholarship package, which frankly, a lot of people can't get, even if they deserve. And I would say, it's not worth it. Why would I do that? So we have loan repayment programs, but we haven't put enough into them, I don't think. We need to keep doing that. And, you know, we've added some in the recent years to loan payment programs, but still not enough. And then my one other thought is that we also need to increase the pool. So when we look at, you know, we're all arguing over amazingly talented future physicians who are from racial and ethnic minorities. What? Like, that's not right. We need to make sure that the pool is huge so that we're not arguing over a small group, but we're saying, wow, look at all these amazing people. We're the pool of people coming to med school. So we need to work on pipeline programs. We need to go back to junior high, to elementary school. And I think medical schools have a responsibility to do that, to create pipeline programs and to partner with the public school systems in their district, to go into the middle schools and to support people to get to the point where they can actually go into the health professions. I'm on my soapbox, so anybody else have?
I'll ask you, one of the things when we review the applications for the Gold Award, we're always astounded by how much the applicants, or, you know, the nominees give of themselves. And, you know, I think by definition, the people who get these, who are awarded this award, just give so much of themselves to the people around them, to their patients, to their mentees. And so can you talk a little bit about how do you revitalize yourself? How do you probably don't even see it as you're giving so much of yourself away, but how do you resustain yourself?
Yeah, I mean, it's a good question for me, and it's a good question for all of you, because we all need to think about how we sustain what we do. You know, a lot of people talk about work-life balance, and that's ridiculous. That's, you know, you put a little weight on one end, a little weight on the other, and you hope that, you know, you sort of balance out. I just don't, it's a lot of pressure to think that way. To me, I think of it more as kind of an integration or a sort of ever-moving thing, but I have to keep track of it. I have to make sure that I'm not doing work all the time, and we can do that. Right now, work is no longer at our offices or in our clinics. We go home, oh look, it's on the internet. Oh wait, it's on the, it's everywhere. I think, actually, for me, working with students is what sustains me. So yes, it takes up some of my time outside of work efforts, but interacting with students is so inspiring to me and makes me feel so much better about sort of the world and what I do in the world. That is actually one of the things that drives me and that makes me feel like I can sustain it. And I think it's a question that we all have to ask ourselves. And now you're in residency, it's hard to, when you're in residency, it's hard to conceive of how all of that might work. But to start thinking about the future, and to start putting things, one of the things that I talk about, and I don't know if I've talked to Sofia about this in particular, but is the concept of the front and back burner. So you have to keep some things on the front burner that you care about. So if you care about music, if you care about exercise, if you care about spending time with certain people, family, friends, taking hikes, whatever that is, you have to put that on the front burner. You can't allow yourself, because once you get stressed, what happens, right? You take it off the front burner and you either put it on the back burner or you're just, you know, out it goes, like it's in the garbage, oh, it burns, you can't, you know. You have to keep it on the front burner. That doesn't mean you can keep everything on the front burner. There's only so many burners on that part. So you have to decide, what are the things that I really, really care about that I'm going to keep on that burner? And then what are some of the things that I can put on simmer? I don't need to take them all the way off. I don't need to give up on them. But sometimes, when it's really busy, really stressful, when you're in the middle of internship, things have to go on simmer. And my suggestion is to make some decisions about what you prioritize now versus what you're going to prioritize later, and then tell someone about it. Be accountable to someone, have them tell you, and be accountable to each other, so that I could say to Sofia, gee, Sofia, how's your music going? And she, oh, I haven't really done that recently. And I can say, you need to. It's so important. It's what makes you continue to do the good work that you do.
Beth, your responses to these two wonderful questions lead me to ask a third. And that is, what happened? We have a 2,000-year tradition of training which placed the patient at the very center of what our administrations were supposed to accomplish. And in the last 25 years, I think we have all accepted, the leadership has accepted, an equation that is impossible to solve. And that is a value equals quality over cost, where quality is undefined and certainly doesn't include any of the characteristics of those 7 listed on the Gold Foundation's principles. How do we move back to the future? How do we solve the issue of refocusing our efforts on compassion and empathy and placing the patient at the center, recognizing critically that the reason the patient suffers the system, the reason 60% of physicians claim they would leave the field right now if they could, is because we have allowed an incredible separation between patient and clinician. We've got to move these two things back together again.
Yes, I agree. I mean, it's really true, and it's I think it's potentially very discouraging. I guess, so a couple of responses is one, doing this kind of thing, but making it even more so, doing it everywhere, and having these conversations and talking about humanism and talking about high quality care and patient-centered care. I think, and I'm going to give an example so it's not a great response, but so in primary care, we are trying to transform what primary care looks like. And Tom Bodenheimer, who is recently retired and is based in my department at UCSF, and Kevin and some of our other amazing colleagues have spent a lot of time thinking about how do we transform primary care, because it's just not sustainable, it's not doable. Not for the patients, not for the system, and definitely not for the providers. And I think one of the things we're trying to do is really rethink what is the role of the physician. Yes, our role is to interact with patients, but our role is also to interact with our teams and to think about how does our team take care of patients. At UCSF, we're starting a new curriculum called Bridges, and a lot of it is going to be about having students early in their medical education be part of systems-based care, so doing QI projects and getting into clinics. And part of that is to say, that is your role now. You can't, I mean, some people will be the lone physician, thank goodness, because they're going off into rural areas and doing the work that needs to be done. Hopefully, they're also working with physician assistants and nurse practitioners. But certainly in urban and suburban settings, we're going to be working in systems at the micro level and at the macro level, and we need to learn how to do that. We need to learn how to lead teams. We need to learn how to be good followers. And we need to make sure that we're all doing that. So it's not just, oh, I'm the doctor and I'm going to have this great relationship and I'm going to be compassionate. It's like, no, I'm the doctor as part of a team. And we're all going to deliver compassionate and high quality care. And I think although a lot of this discussion is happening in primary care that I know it's happening in other fields. And I think we need to make that happen, because I know all of you have heard some of this talk, but you don't necessarily see the rubber hitting the road. And so that's, I think, where we come in, is we have to at least make the rubber hit the road so that you all can take this forward and make those make our healthcare system transform. I would also say we have a responsibility to society as a whole. This isn't, health is not about healthcare, right? That's a like small slice of the pie. We need to be engaged in thinking about social determinants. We need to be working and supporting our school systems and thinking about safe neighborhoods. It doesn't mean we have to go out there and do all that work. We don't also have to teach at high schools, but we need to support our high schools. We need to speak out. We need to sit on boards. We need to go and talk to our legislators. So I think we have a much bigger role than maybe we first imagined as just the patient-doctor relationship in order to enhance the patient-doctor relationship.
We have time for one last quick question.
I'll give it a quick answer, maybe, unless it's,
Yeah, so I'll just ask really quickly. So thank you for your talk. I was struck by Sophia's comment that about the resident who you helped course correct. I have to wonder if there, even if our institutions have outreach programs or merit aid or aid for people of underserved populations, are there still intangible aspects of our institutions that make people say, I don't belong? And if so, what do we do to address that?
Great. Well, there are, which is why you asked the question. Good question to ask when you know the answer. That is another conversation we have to have. I have to say that this conversation has really been taken up a notch at UCSF over the past year. So when the students started the White Coats for Black Lives movement by the die-in demonstration last December, they were scared about it. It felt like something they weren't sure if they would be supported to do that. To say, actually, it is the doctor's responsibility and healthcare professionals' responsibilities to stand up or lie down in this case, to bring attention to talk about it.
Please join me in once again thanking and congratulating